something happening here. What it is ain't exactly clear. There's a man with a gun over there, telling me I got to beware. I think it's time we stop, children.
Hi, welcome to episode 38 of Occupy TV. I'm here with Sue Sierra Lupe, and we're going to talk about healthcare today. So I guess you've been involved with the Occupy medical tent and that whole thing from when the camp was at Washington Jefferson on into today. So tell us all about that.
Well, we actually started the tent at the very beginning at the park blocks, and my husband and I initially went to some of the meetings before the occupation actually happened at the end of September and early October, and it just seemed like our view of what was going to happen at the camp was very different than what actually happened, and we assumed we would just be a little triage tent, and then we'd pass out Band-Aids, and we would give people aspirin, and then when there was some exciting Fox News related item, then we would go and patch up protesters. And that was really the way we visualized it. So we had a little tarp covered canopy, and we had a little table and some camp chairs, and we sat there smiling and waved our Band-Aids in the air and passed out antacids at the beginning. But then what happened was the medically indigent population began to appear, and they were the homeless
Yep.
and the people without insurance, and they discovered that they could use our resources for more than just getting their blood pressure checked, and they began to show up in waves. And some of the things that they had as long-term serious issues, some of those things that had caused them to become homeless in the first place turned into things that we were treating for them. And we, although our professionals were experienced with dealing with those issues, it was not something that we were expecting.
So let's back up just a little second. So what you have is a lot of the homeless wound up being homeless because of medical problems?
Yeah, a lot of those conditions that some of these people are suffering from, they're very expensive to treat, and you do need to constantly treat them. Hepatitis would be a really good example, which actually at this point in America is killing more Americans than AIDS, HIV. And it's hepatitis B and C, of course. Right. And that one, although we do have a wonderful program for educating people about needle use and sexual protection, etc., it's still slipping through the cracks. And hepatitis can be, one of the hepatitis can be shared by fecal matter. And since we have people living under bridges, by waterways, and in parks where there is no public sanitation, then people are just going to the bathroom where they are naturally. In Eugene, we shut down the bathrooms in the winter, and where the homeless are supposed to go, what do? Are they supposed to hold it for a couple of months? Of course not. So they just go where they can, and they try to be discreet about it, but unfortunately that does mean that it goes into the waterways or into the soil, and then that is, unfortunately, their condition is shared with other people that also sleep in the bushes and things like that, and it's just spreading like wildfire.
So in other words, the fact that we do not give the homeless a place to go to the bathroom is actually causing a serious public health problem.
Right, and
Like, duh, folks, come on, it's time to think about a place for the homeless to be.
Yeah, and we've always had hepatitis. It's one of our older diseases, but it has been growing exponentially over the last few years, and it might just be a coincidence that it's growing at the same time as our poverty rate is growing, but actually I don't think so. And one of the other things is that we're starting to chart those things. So we, as for public health, the CDC is really taking a stern look at what's happening with hepatitis and some of the other killer diseases. And MRSA has been expanding tremendously. People go to the emergency room now 27% more often now that the economy has tanked, rather than going to a primary health physician. So they get something unpleasant in the hospital, and then they go back and share it with their friends. And of course, it's going through, the senior and disabled population. It's not just homeless.
So you're talking, I mean, when you say they go to the hospital and they pick something up, we had this problem that people referred to as the camp cough, which is at Washington.
Bronchial.
Exactly, a whole collection of different things, and just simply having that population that has not been getting medical care,
Right.
has not been dealing with these things, and you bring them all together, and then suddenly everyone who's coming onto the site to help, or the people who came there originally as a symbolic protest, are all of a sudden getting all these bronchial problems.
Right.
And I mean, I had that for a good 3 months, and it seemed like what it was one thing that you would sort of get over, and then you'd pick up something, and you'd get over
Right.
that, and you'd pick up something, and eventually, because it all seemed like it was okay, the kind of stuff you normally wait out,
Right.
and oh, it's over, I'm done, oops, here's the next one. And I finally got an antibiotic and cleared it right up.
Right.
But the thing is that if the homeless do not have access to health care, all they're doing is acting as an incubator to proceed to spread this stuff further.
Correct. And because they have such a low immune system, they're living in an incredibly stressful situation.
Bad diet.
Their T cells, their teeth, oh my goodness, the amount of dental issues for these poor people it's sickening to me. You see a 24-year-old kid come in, and he's got 4 broken teeth. His gums are all inflamed because he has cavities that aren't being treated. That goes septic, that kills people. And for us, when we were there helping people, yes, the bronchial condition did spread, and there were some people walking around with pneumonia, but for us, it didn't kill us.
Yeah.
And for the homeless, because they weren't getting treatment except from us, and there was a lot of things that, of course, were not a hospital, we couldn't help them with, they would just disappear. They would just go off and disappear, and where they went, I can't even imagine. But this is why the mortality rate amongst the homeless is so high. They get something bad. When we go home, we sit in our beds and recuperate. They're under a bridge. It's cold. They don't have anyone checking in on them, and it simply kills them.
Yeah. My understanding, we did have one person on the site who died, and the circumstances around that are questionable. But I don't know that we want to go deeply into that today. But at that time, I was told that he was the 112th homeless person to die last year of unnatural causes in Eugene. And if there's the estimates are that there's probably close to 10,000 homeless in Lane County, which would mean that there's probably somewhere around 4,000 in Eugene.
And growing.
And definitely growing. And so 112 people out of 4,000, that's a very, very high death rate.
Yes, and I would venture to say that if it wasn't amongst the homeless population, we would consider that an epidemic.
Yeah, really. But of course, these people, we have this stigma, about this, that it's their fault, therefore they deserve it, we need to punish them, they're bad guys, etc. And when you start to listen to some of these people, they're homeless because of beatings or molestation in the family, alcohol, mentally ill parents, the whole rest of the thing, if you're talking about the street kids.
Right.
And
vets, for instance.
and then you talk about the older folks, they're there, vets with serious PTSD.
Yes.
Untreated, they did their service, we throw them away now and we don't care.
Right.
But other mentally ill, people with problems who, need some help on that. But then the big chunk is people who are forced onto it by foreclosures, by personal bankruptcies.
Right.
And again, we bring health care in. It is fully 4 out of every 5 personal bankruptcies in the United States is due to a health issue.
Yep.
And out of that 4 out of 5, fully 4 out of 5 had health insurance. And so what we have is people who think that they're covered, and then the companies say, too bad, we're not gonna pay this, and their life savings disappears. I mean, I know people who've gone through that process.
Yep. They're just holding on to the phrase of the end of the rope. And actually in Oregon, the statistics are even scarier. 60% of the people that lose their home is because of medical, but 80% of those people had health care.
Yep.
They had health insurance, but it just wasn't adequate. And that brings us to the point that a lot of the people in the medical community of Occupy Eugene are really struggling with is we can't continue to endorse and deal with as professionals, the insurance issues that keep coming through the door. A lot of people are losing money. They're losing homes. Even though they have the insurance, they're paying out all this money, but it's going to absolutely nothing. The deductibles are way too high, or the coding issues, which are incredibly complex. If you look at your insurance bill, for example, this is one of the ways people can save money, is look over the codes, make sure that they match the conditions, and don't just assume that if the insurance company isn't going to pay for it, that means that it can't be paid for. Most of the times, because there are 3 different codes. One code matches the disease itself. One code will match what it actually is being treated, and then the other code is like a standard code. So and all of those are very different. One code has 5 digits, one code has 4 digits and one number, and one code has 3 digits and one letter. And they're easy to mix up, and people have been screwed for thousands and thousands of dollars just because of a coding concern. And people have to look over their insurance bill and be very, very succinct about it, and then call them up and say, I noticed that even though I came in, for example, for an IUD, and STDs are required to have tested, that you guys are not covering that. Now, those are your rules.
Right.
You have required that this STD testing, which I am comfortable with, I know I'm all right, that is part of how I get the golden diagnosis that I will get an IUD. So you're telling me that you're not going to pay for it. Well, it's your requirement. You have to, by law, pay for that. So if people actually go, I mean, I know nurses that's one of their big things is they look over their own bills and then they exact it from the companies.
But the issue that you're looking at is people who have expertise in this field, people who have experience are saying, look over these bills, but the average consumer doesn't have the time,
Right. Well,
or the expertise,
or the confidence to do it.
The confidence, the access to information,
Right.
and all the rest of this, to go up against an insurance company, to evaluate these things. And it's sort of, you're already sick, okay? They've now wiped out your life savings.
Right.
And you're sitting there, and it's like, okay, now you have to figure out this entire industry
bill, right.
in order to figure out whether they stuck it to you or not. And, you know,
but
there you are.
most people aren't even asking those questions. That's part of the thing that we're trying to fix with our clinic is people just assume the doctor's right. So whatever they're being asked to pay for, that's what they should. You know, they made the error of having a liver that was not working very well, or goodness sakes, they're aging, and you know, if they were a good Christian, they wouldn't be doing these terrible things, and they just have to pay for it. They can't ask, and if they ask, they're being a pain, and that's simply not true. So people are losing, you know, billions of dollars. As a nation, we're being gutted by the fact that we just won't question these doctors. And there are 600,000 doctors in the United States. And you can guarantee that with all of the patients that they have to see, since there's such a small amount of them, there will be mistakes. There simply will be mistakes. There'll be mistakes in their judgment, there'll be mistakes in the coding, there'll be mistakes all along the line, and you have to, as a patient, ask questions the whole way. That is your moral obligation, and that's the kind of readiness that saves lives. And in the clinic, we don't have it set up so that the doctor makes all the decisions. You know, we used to have the first aid tent, and then we changed it so that it's an actual clinic. People come in and they get, you know, we talk about what's troubling them and try to get a rounded view, you know, not just, you know, the medical problem. Then we go into their vitals, and that's another check-in. Then they go in and talk to the doctor, and then comes the revolutionary part, where they go to the last step, which is getting nutritional support, getting herbal supplements if they require, talking about exercise, getting, you know, their pharmaceutical needs met at this point. But we also have a giant book with resources. You mentioned that one of the problems is your brand new rental that you picked up. It has a really low a sink, so that's you're bending over the sink a lot. Where is that rental and how are you paying for it? You know, it might be that somebody's sleeping on someone's couch, and you know, there's just so many different reasons for some of the pain that people are suffering, and listening to those problems that people are talking to and figuring it out as to what in their lifestyle we can help them with. A lot of times it's not that hard, and we have to be very flexible. I mean, we're in a tent, we're on the concrete, we're in a giant park, and we can't be very hygienic, but we can be flexible.
And you're doing it for free.
And we're doing it for free, yeah. And some people have come to us, and because of their mental illness, they won't come into the tent. It upsets them. They certainly wouldn't come into a hospital. They wouldn't even go into one of our wonderful free clinics out there. But what I have done is gone outside of the tent and knelt next to them and sat with them face to face, and put my hand on their shoulder and given them the information that they need to go on and get the, oh, you've got pain, and let's talk about why that is, and here's some vitamins, and here's some turmeric to help with the inflammation, and here's some whatever I can do to help people out. But I have to be flexible. It's all about the patient, and that's the big difference. Is we are motivated to help the patient, not helping the doctors. The doctors are the helpers.
Right.
They don't get to make all the end all be all decisions.
So that's really important.
Yeah.
Okay, in the sense that within our current system, okay, the patient comes in and the system is in charge.
Right.
And what you're talking about is the situation where it's the patient's interests that are being taken care of rather than the system's interests being taken care of. In other words, reversing what's going on in mainstream medicine.
Right. And that kind of unnatural thinking that the person that is having trouble should not be part of the healing process. That's just, it's peculiar and it's unhealthy, and it really is killing people. And yes, I do want to have single payer health insurance. I'm very excited about that, and I do think that the captains of industry need to be paying for this because they're the ones that broke it. But truly, when it comes down to, when you're talking about outcomes and et cetera, and what's going to help our country as a whole, that's just a small part of it. We need to change the way that we look at how our bodies are treated, and if they are in fact our bodies, and our rights to our bodies, and the way that we educate ourselves about how healthy we are and what constitutes health, and what are our neighbors doing, what are we doing as a community. We have to expand it, and we're just, it's very difficult.
See, years ago I started doing down in Southern California when I was living there. I've been in Eugene about 5 years now. I started doing talks on single payer because there was a bill that was making its way through the state legislature down there called SB 640, and Sheila Kuehl, who's now been term limited out of office, was the person who was backing this. And so I did a lot of work and, of course, a lot of research on that kind of thing. And one of the things that I pulled up was this stuff about why do people die? And there's a list of things that are on death certificates, which are generally fairly technical terms. But if what you do is you convert those to kind of common language, you have, heart attacks and strokes and, whatever that goes down. And at the time, when I first started doing this in 2004, actually speaking about it, single-payer healthcare, has been on the radar considerably before that. But there was about 19,000 people in 2004 who would die because of denial of service. By 2007, it had reached 30,000, putting it in position number 7. It had just edged out handguns. In other words, people shooting each other in the society. Denial of service would kill more people than handguns. And now it's moved into position number 3. Okay, position number 1 is cigarettes, which kills 450,000 people a year. Position number 2 is poor diet and lack of exercise, which relates in obesity and diabetes and all that kind of stuff, which would kill 330,000 people. And now we're in position 3 for denial of service.
Right.
But we look at the health issues, and who's making money on cigarettes? Okay, who's making money selling sugar and fat, and all the rest of this stuff to people because it tastes good,
right?
But it's not good diet. Okay, and then we have outright denial, people collecting money, okay, but not paying for the services in this system, and then they say, oh, we didn't have the right codes and all that kind of stuff. So at a certain level, what you've been talking about is the interaction between the individual, who needs the services and the service provider. And that's incredibly important. But we have this larger picture about the society as a whole, and people are making money, okay, selling you things that make you sick. They are also making money selling you health insurance, and they're making even more money by finding schemes to deny paying the claims.
Right.
Okay? So we have huge concentration of wealth in this country because we have that entire system in place which is not serving people well.
But it's a little short-sighted for companies to look at the healthcare industry in that way. We're making a lot of money off it. Well, truly, we would be making, the companies in general, except for a healthcare industry in its own, they would be saving money hand over fist if they just changed it to single payer. The amount of leverage that they get over an employee with the way that they're treating them, like, well, you don't want to strike because then you'll lose your health care benefits. That's a big thing that they like. But companies lose money in America by doing health care the way that we're doing it. So in reality, it's true that we have companies that don't want universal health care, but they're really short-sighted, and they're going to have to be dragged kicking and screaming into a system that works. We had that already until 1966. I believe it was 1914 until 1966. We had a lovely little health care system that we all worked on, and it really benefited the large companies in a whole. But then we jettisoned it, and now look where we are. We need to resurrect some of these things that did work. And the Republicans right now are trying to get rid of even our basic item, which, in 2010, Obama signed over the, let's see, I have the name here, the Patient Protection and Affordable Care Act. And that's why I personally have Obamacare, right, which is why I have health care. I didn't have health care before, and I'm delighted to have it, and it is truly an honor. And it has saved so far our country $143 billion. That's a lot of money to save, and that is passed on to the entire community.
But the issue is that $143 billion would have made it into somebody's pocket, okay? And if they can go back to the original system, then the 1%, which is what we talk about at Occupy, would have pocketed that $143 billion.
Right, and they are, and we have to stop looking at what's good for the captains of industry. We're really good at protecting those people. You'd think that they are fragile little flowers sitting out there in the lawn that need to be taken care of, and they don't create jobs. What does create jobs are having more schools, or having educated people, or having healthy people. If you have a healthy society, then that's a country that can really move and shake. That's a healthy, exuberant society that I want to live in. You can't just say, oh, well, I have to take care of this poor little billionaire and trillionaire, and it's so sad that they have to work so hard to get an extravagant painting that's actually a national treasure. Oh, pity. I feel so bad for them. And I don't buy anymore, and I don't think anyone does, that they care for us. They really don't give a toot.
I'm impressed. You're one of the few people who's done more moral outrage on this show than I have.
Oh, just get me started.
and rightly so. I mean, if we look back, the United States is the only industrialized country that does not have a universal health system. And because we don't, we are spending more than any other country.
Yes, our tax rate is over 16%, just dealing federally for dealing with what falls between the cracks. That's what we have to pay. Actually, in places like Australia, they do have the single-payer system, and it's 1.5% tax rate. That's what they're paying. So it saves us as taxpayer money to have the single-payer system. I'm sorry, the healthcare system that's related to insurance has to be changed. It just has to.
Yeah.
You know, it's clearly very broken. It's ailing. We need to pull the plug.
Yeah, looking back at the numbers, in 2007, in 2001, the World Health Organization put out a report, and the Bush administration, after they came in, were just livid. But what it said was that the United States ranked 37th in healthcare outcomes compared to other countries. And what that was to take a series of indicators, some just statistical, like doctor-to-patient ratio or those kinds of things. But life expectancy, infant mortality, number of mothers who die in childbirth, morbidity from cancer, the list goes on and on and on and on. Infectious diseases, the whole thing, a whole number of metrics.
Right.
And then all of those were weighted and computed, and it turns out that our overall health care in 2000 was 37th among nations in the world.
Which is embarrassing.
It's completely embarrassing. And what then happened is in 2007, they put out a second report and looked at the amount of money that that each of the societies with their different systems paid. And we turned out to be number one. We paid more for health care per person than any other country on the planet, period.
Yep.
And at the time, it was our contribution was 15.4%. The next highest, I believe, was West Germany or Switzerland at about 10.5%.
Right.
So we were putting in 15.4% of our GNP into healthcare. That number has grown to 18.6% is what we're currently paying. And there's no end in sight to this growth at this point.
Yep.
And so the problem is that if our companies, who give health insurance, because our health system is so expensive in the United States, are at a competitive disadvantage with companies overseas who are contributing into the healthcare system, but as a percentage of GNP, their system costs less. They get better health outcomes while paying less money for it, and yet in the United States, we still persist in this system.
Yep. We're buying a giant bag of Doritos, and there's only 4 Doritos in it.
Yeah. Is it an American value? Is it something that we're proud of that we pay more to get less? I mean, is that a value in America that we're proud of, that we hold up and say, yeah, man? I find, all the arguments I get talking to people about this kind of thing, and it really comes down to that value. Are you proud of the fact that we are paying more to get less?
Right. And if you really want to change the hearts and minds of the voting public, you got to look at their pocketbook. I mean, the single-payer system, we've been trying to tout it in Oregon for a long time. But people will say, well, people are dying, but it ain't anybody I know. There may be 1 or 2 people I know, and that's really sad. But when it comes down to it, it's probably because they were naughty, or they shouldn't have been.
God is punishing them.
Yeah, whatever the reason, it's fascinating to hear the little loops that people go into. If you really want to change them, you tell them this will save you money.
Yeah.
You will pay less taxes, and you will be healthier for it, as will all of your neighbors. And when your neighbors are healthy, your entire environment is healthy. I mean, it's pretty clear if you talk to someone and say, okay, let's say your neighbor's house is on fire.
Right.
Would you say, I'm sorry, you all don't have insurance, so just let it burn, because your house will get on fire?
Or go to the telephone book and start looking up fire companies, and you call them up and say, how much are you going to charge me to put out the fire at my house?
Right.
Oh, that's too much, sorry, let me call the next one.
Yeah.
Okay? In other words, you don't have a choice at the moment that you need.
You just got to get it taken care of. And you have to make sure that your neighbors are not on fire. That's not very good for your home. Not good for your insurance premiums, that occasionally houses in your neighborhood burst into flames. It's lose, lose, lose. And if people start getting that mentality and looking at their health in the same way, I think that we'll have a lot more action on the single payer. The health care is a human right. That's a really good rallying cry, but that's not actually what's going to change people's mind. If we say single payer will save you money, then you're going to have people running to the ballot box and checking. And, you know, no matter what, we just want people to motivate.
Yeah, but, okay, let's sort of step back a little bit.
Okay.
If we look at the United States, we have a disaster, and we know what that looks like. Okay? But if we look at other countries that have universal health care, there's essentially three systems. There's national health care, like you see in Great Britain,
right,
where the doctors and nurses get a paycheck from the government. It's socialized medicine. They pay less for health care and have better outcomes.
Correct.
Okay? There's Canada, which is single payer, and there's other countries doing the same kind of thing. So there's three types of systems, but Canada is an example, where insurance is paid into a single pool, and then all of the private health care providers send their bills to this pool for the services that the citizens receive.
Right.
So that's Canada, and it's interesting because, again, they pay less and they have better overall health outcomes than the United States does.
Yeah.
The third system is what's called the Bismarck system, which does keep the insurance companies in the loop, but they are very, very heavily regulated. Okay, where they can't play the kinds of games that are being played in the United States. Even, you know, Obamacare is a major improvement.
Right.
But it doesn't solve the problem completely. It doesn't, you know, it's kind of it's kind of the first of 100 steps to going from where we are to, you know, a Bismarck system. But again, West Germany, okay, has lower costs, you know, per person for health care and better outcomes on this system. And everybody is covered.
Right.
Okay, you have a problem, you go see the doctor. You don't worry about, you know, whatever. Or if you're homeless, you go see the doctor. I had a discussion with one of the police officers, Jennifer Bills, really nice person, just wonderful, wonderful person in Eugene. About this, we were talking about Occupy and the homeless camp and healthcare and all this kind of stuff kind of rolled in. And she said that in Toronto, for the homeless, they have this big center where the homeless can come anytime they want, and all of the providers are there, the medical and the dental, and, you know, people to deal with outstanding warrants if the police got you, and, you know, all that kind of stuff that you can, you know, go through and get these problems taken care of.
Right.
And simply live there, you know, get alcohol treatment, get, you know, detoxed on drugs, you know, whatever you need to do, showers, go to the bathroom,
right,
you know, etc. All in, it's one-stop service. And she says, that's what we need in Eugene. And she's absolutely right. But the issue that we have that makes, you know, that we have in the United States versus Canada is in Canada, they have single payer. Okay? They have universal health coverage. Everybody is covered for life, for everything. So when you have an alcohol problem, you walk in and the system pays to deal with the alcohol problem. Put you in therapy, you know, get you off the, you know, get you detoxed, put you into a support group. With drugs, same thing. You know, with hepatitis, with anything. In other words, it's all covered, whereas in the United States, it's not. And so we have this pool of people out there. And in Canada, when you decide you don't want to be homeless anymore, it's time to clean up and get your act together, the services are available. In the United States, it's like, you know, we're going to make it harder and harder for you to get off the streets because the police are going to keep giving you these nuisance tickets, which of course you don't have the money to pay, which turns into an outstanding warrant. Now you're pushed further into the system. And I've ranted for a while, so it's your turn.
Okay. And people are also pushed further into isolation. And that's one of the big things that we stumbled onto in the clinic is that an isolated society tells itself lies. You know, when we look at, we just see patients. That's it. You know, we don't see, well, this is the homeless person, this is the housed person, etc. It's just patients.
This person
and they
has
all,
money, this person doesn't.
Right. It doesn't, everybody looks the same in a hospital gown. You look like crap, you know. I think they make them look that way so that we're more likely to treat them, you know, like, oh my gosh, you look terrible, let me help you. I don't know, maybe it's coincidence. But our job is simply to help people, and we we don't care about that isolated thing. We see them as part of a patient pool. So, here comes our hepatitis patients, here comes, the young teen that's pregnant, so they're part of that. We kind of view people by the disease, and they need to be treated in such a way that the thing that is troubling them is eliminated so that they can continue on their bill of health. They can continue to be the person that they are. So we have to stop pushing people into the corners.
Yeah.
When people are pushed under the bridge and people are made invisible, and the homeless are very good at being invisible, they get sicker and sicker and sicker. Yeah. And when you've got an elderly person that doesn't have people visiting them, they get sick and they continue to get sick. Yep. We can't have that. When people come to us, a lot of the things that they're talking about, we can treat right then and there. It's little problems, and we're happy to be able to treat it very quickly, preventatively. But one of the big things that we offer them is, would you like to have a hug?
Yeah.
We've had people that come in and they talk to the doctor, and then, well, Sue, we need you to come in here and talk to this person. They're a little bit troublesome right now. I don't know how to help them, and I'll come in and talk and listen and just reach out and give them a nice little mom-sized hug, and they hold on.
Yeah.
They hold on for a long time, and that is a sign of an isolated society, and those kind of perspectives that I am alone in the world, that causes sickness, that causes stress, that causes people to crumble, and we have to stop that. I know it doesn't seem like it's related to healthcare, but this mindset that I am alone, if I get a bill that I can't pay, I should just go out on the street. I can't stress enough the importance of understanding that we are herd animals and we're all in it together. That's what Occupy has done, is we've all joined together and said, you know what, I'm mad and you're mad too. Well, let's get together and get angry together. Wouldn't that be lovely? And then we can change things. And that's one of the blessings of being in the Occupy movement, is not only are we offering a positive model for healthcare, and we're trying to change things from the inside out, but we're also all together. And we realize by sharing our stories that the complaints that we have, it's not just us. It's something that we together can change and are changing, and that it is a moral obligation to change it. And it's feasible and possible because we're actually part of a group.
Yeah. So let me tell two stories. First story, I actually had health care at the time this first or health insurance at the time this first incident occurred. But it wasn't first dollar care, it was catastrophic stuff. And I was coughing up this green phlegm, and it just seemed like it was one of these times that it wasn't getting better. And so I, broke down. In Southern California, used to be able to go into these doctors and say, I need a script for an antibiotic for something like that. And for $40, they would write you a script, and you would go get your antibiotic, and the whole incident was $100. I go looking for that in Eugene, okay? And I walk into this place, and they say, to see the doctor, it will cost you $450. And I looked at the receptionist there, and I said, for $450, I would rather die in the streets. Okay, that is not acceptable. And I started to walk away, and she goes, oh, but you could see a nurse practitioner for $98. And I said, okay, and he can write a script for this thing. And she goes, yeah. And I said, okay, fine. It's worth $98 to get this thing fixed.
Right.
So I got fixed. And then I contrast that to when I got the antibiotic to get rid of the camp cost. When I walked in to the Occupy Medical Clinic down, I guess you guys were at the Federal Building, and walked in and said, I need to see the doctor and get a script for this. And so the first night, I got poked and prodded, which was great.
We just love that there.
Yeah, it's like took my blood pressure and temperature and all the rest of this, and then somebody actually listened to
your carotid artery.
Yeah, just to hear for how clogged it was, and squeezed the bottom of my leg to see whether I'm doing diabetes, and all the rest of this stuff. And I'm watching this and I'm saying, somebody cares. I mean, the group that's here, you know, there were several people involved in this process.
Right.
And one after the other, they're taking me through and giving me essentially a physical exam to find out if there's anything else going on
Right.
that I should know about. Did that happen when I paid the guy $98 for the prescription? No, it did not. And I, you know, got in, talked to the doctor, and, you know, asked a couple of questions, and he took the time, and what an incredibly different experience.
Yeah.
Okay? And there's something wrong with a country, okay, where people will insist that it's God's plan that the $98 experience is the norm, okay, and the free experience is not the norm.
Right.
Okay?
Because that experience was built by people, and that is what we have to keep overcoming in the clinic again and again, is we have a human society that's just full of human mistakes, which means it can be fixed by people. So when people come in, they will, you know, every physician knows this, that there are displaying symptoms, but each of those symptoms can be a trigger for some other really root cause disease. If someone says, oh, I have insomnia, you know, you could throw sleeping pills at them, but what's the reason they have insomnia? Is it because they have digestion problems? You know, is it because they've got depression? Is it because they've got a noisy neighborhood? You know, there's a lot of different reasons for the symptom, and to continuously throw Band-Aids onto symptoms is poisonous.
But the Band-Aids being thrown at the symptoms are big pharma. I mean, it's drug companies making money, selling you things that you probably would be better off if you weren't taking.
Right. And because the hospitals are so strapped now you've got your little physicians treating a larger group of people. The nurses are being spread out even thinner. So they have their little handheld device that they can look on and figure out, oh, from here it appears that I can give you this drug, and then you'll be able to go on your merry way. I don't have time to talk with you. I don't have time to really diagnose you. And honestly, at many of the hospitals in this area, depending on what kind of insurance you have, that's what kind of diagnosis you're allowed to have. So if you are medically indigent...
Diagnosis you are allowed to have.
Correct. If you are medically indigent and you walk into the emergency room, there are certain diagnoses that you cannot get because it requires testing that they know you can't afford, and they can't afford to give you.
Right.
So that's what leads to our mortality rate. That's what leads to more complicated issues. Someone may come in with a small diagnosis that could easily be treated, but we can't treat them for that. We can't even investigate that that might be a possibility, and so it turns into something more complex. And then, you know, I have a friend that just died of liver and pancreatic cancer. A lot of these conditions that she was suffering from, she was interested in going and treating. She had gone to the doctor before, but she decided not to go to the doctor again because she was still busy paying off her medical bills. And she waits a couple of years, and now she's dead from a, And that's not the only time it happens. And that's what I just keep want to reinforce, is that we aren't alone. We are all together. You know, healthcare for all. We're a group. We're a cluster. We belong together. We're happier when we are together. We may rail to the heavens, this person is driving me crazy, but it's another person, and it's our natural state. And isolating us is poisonous. We have to stop that. That's what Occupy has really been teaching me. You know, I appreciate it. I'm grateful to be with these talented, wonderful folks.
Yeah, and I think it's not just the talent; it's the attitude. It's
because we're so wonderful. But they are great people. I adore them. There's such a... The Occupy Medical Clinic volunteers come from a huge range of backgrounds. You know, we have a Reiki teacher. We have, of course, the physicians. One is a holistic physician. We have a variety of nurses that work in different backgrounds. We have people that are in nursing school. We have medics. We have EMTs. We have people with a first aid card. And, you know, they're like, well, I could go get someone a prescription. Can I do that to help? I mean, people walk by the park and they say, oh my goodness, look what you're doing here. They may not know anything about what we're doing, but they just see people are treated. They see a line of folk getting treated, and they're like, can I give you money You know, we have a retired nurse that comes by and is like, okay, as long as you keep doing this, I'm going to keep giving you $100 out of my retirement fund.
Yeah.
Because it's needed to happen a long time ago.
So you've had some, well, I could tell a couple stories, but let's skip it. You have, I guess, some victories. You applied for a grant, and you're getting some kind of a mobile
clinic.
Yeah, so tell us about that.
We applied through the Oregon Community Foundation,
Yeah.
and they're just a delightful group of people, and it's all for Oregonians that have money and they want to put it into something that's worthwhile. They just don't want to throw it at some system that's not going to be long lasting.
Right.
So they collected a couple of different donors, and they gave us, they will be giving us, it's still in the works right now, $30,000, and we'll put that into a mobile clinic. And the advantage of that is that, one, it's hygienic. You know, we can clean it, which, you know, back when we were in the camp, we had a mud floor, you know, and we put in pallets, and you'd walk in and you'd see one of the volunteers with a rag and a bucket. You go, oh, God, please, you know. It was terrible, and it was cold, and, you know, my stethoscope, even though I would have it in my coat, I bring it, I'm like, I'm so sorry, this is really going to hurt, but I'm trying to warm it up the best I can. And boy, you'd see people correct their posture so quickly when that stethoscope would go on. But it was, you know, it's what we had, and we just had to deal with what we had. So now that we'll have a mobile clinic, we can go to outlying communities. Right now we're bound to the park.
Right.
And we can, if there's an emergency, we can just jump in the car or in the van and just tootle on over there and take care of that. If there's something at the coast, we can take care of that. You know, we can serve all of Lane County, not just the downtown area. So we can also store our equipment safer. We can bring more things there. We've had a large collection of donations that are physical donations from Sacred Heart to the tune of over $20,000, which includes a microscope and some other lab equipment, stools that aren't camp chairs, you know, the rolling ones, just things that will make our lives a little bit easier. And we are good at making do. I don't want to sound like we're a bunch of spoiled brats, although some of us are kind of spoiled, myself in particular. But it is nice to have, you know, you don't have to paste things together to help the person, and we'll be able to do some more lab results, and we'll have a bathroom on board so we can take urine samples, and you know, there's a variety of things that we can help people with this van. We also have, this summer we'll have a monthly dental clinic that comes in a mobile clinic of its own, and we'll be able to have 2 dentists and 2 hygienists working simultaneously, and that will be announced within the next month. We have secured the funding for it, but we need to get the volunteers right now. So we're very excited about that, and a good 1/4 to 1/3 of our patients have serious dental issues. You know, they don't have many teeth left, and the ones that are there are in a lot of trouble, and they're in constant pain. They're just used to being in pain. You know, if you're homeless, you're just in pain. That's just the way it is. Excruciating pain usually, but, well, that's what happens. And those are the kind of things that kill people. You know, as I have said before, dental is one of the things you don't mess around with, because it can go septic very quickly.
Well, things like Whitebird are wonderful clinics.
Yep.
But again, they're very limited in the number of people they can serve.
Right. They're only open 3 days a week now. They do have dental, but they are a building, and there's a lot of people that are concerned about going into a building because of their mental health issues, and the line is really long.
Yeah.
So if you don't have a house that you can call up from and say, well, I'd like to get the appointment, the advantage of our clinic is people just show up.
Yeah.
They just show up. And we also have extraneous care. We have every other week we have someone that shows up and gives haircuts. And we have seen people sit there, you know, they're like, oh, I'm getting my hair cut. And, you know, they're used to being picked on, and here's someone just, you know, combing his hair and
Benjamin's
helping
wonderful,
him out.
isn't he?
He is a delight. I adore Benjamin. And you see them just start to soften, like, oh, someone's taking care of me.
Yeah.
And they just, I don't know. I delight in seeing that. I think that's health right there. We also have the back massage. We have the body work day. And we have so many people come in with chronic pain. Sciatic pain is the worst. One woman came in and her children were helping her because she couldn't walk. She couldn't move forward. She couldn't sit. Everything hurt. It was excruciating pain. And after she had gone through our little rigmarole, like you said, the poking and prodding, we gave her anti-inflammatory, and then we had our Reiki person there who had her lean against the stool and then just worked on her back so that she could do this crazy thing called sitting up. It was, you know, I mean, that's what we want to see, is that we have so many wonderful services here. Here we are, America, and there are fabulous things that can happen for people from many different cultures. I would love to see an acupuncturist in there helping people. I don't know how that stuff works. I have no idea, but I do know that it helps people, and if it helps people, we need to use it. And I would like our lovely government to pay for that. I would like my taxes to pay to make my neighbors healthy.
Let's key on that for a second.
Okay.
I mean, one of the arguments you get about universal health care is it's going to increase taxes. Okay. The interesting thing is we're already paying for it.
Right.
Okay. Now they say
a lot. We're paying a lot.
We're paying a huge amount. Okay. And the thing about it is that a lot of people say, well, my company, because I'm such a good person and I have a job, my company gives me health care. They don't realize that their whole compensation package includes their salary, okay, and vacation days, and you know, whatever, maybe there's a tuition reimbursement, but then there's this health care package, and it's a big chunk. Which is
not really a gift, really.
It's a big chunk of money. And what would happen is if the company was not paying for this health care package, let's say you make $50,000 a year salary, okay? Then they have, you know, this benefit that's $500 and this benefit that's $700 and a $10,000 for a health care plan and whatever else. So their entire package is $70,000. If they weren't giving you the benefits, they'd be paying you $70,000, and you could pay the $10,000 into buying a health care policy. But they're paying the whole thing. You don't see this part, and you don't realize that you're already paying for it. Because if they weren't giving you this, they'd put it in your paycheck.
Right. Yeah.
Okay? And that is, you know, when I talk to people, that is one of the biggest arguments that I get. And they just don't get it.
Right.
You know, that individuals are already paying for this. It's not being given to you because you're a good person.
Right, and we're paying for it in the dumbest way possible. I mean, it's that same individual model of, well, if you're going to buy a car for your family and you have two people in the household that makes money, wouldn't it make sense if you both put money into this car? That would make a lot of sense. And we just keep doing this. I have to pay this individual way, and it just
we're all rugged individualists.
Money. We're rugged individualists, and it's such a brutal lie. And it's a lie that's just wasting money and destroying lives. And
but it does justify. But it does justify making rich people richer.
Rich people get richer and richer and richer, and rich people bond together wonderfully. They take great care of each other.
They have good health care plans,
and they have parties together,
and
they have just a real hootenanny on their own. And they just think it's hilarious that here are these poor people that I think somebody, Jay Gould's quote was, I could pay half of the poor to kill the other half. And my goodness sakes, he's right. But you couldn't do that with the rich because they've got this lovely bond. You know, we are so isolated that we really do see our fellow neighbors and community members as, you know, our opponents or
the riffraff.
The riffraff, or somehow we're above them, and that's what secures our little place because we're so tentatively balanced. Anything can tip us over, and the reality is all we have to do is reach out our hands, and then we're more secure.
And most Americans do not realize that roughly one third of every dollar that's paid in for health services now, okay, that means government paying for the stuff, private insurance policies, company and corporate insurance policies, roughly one third goes to administrative costs.
Right.
And what are administrative costs? Okay, they're marketing, lawyers to make the denial of service cases stick.
Administrators that have to deal with all the coding, which is astronomical, like I had already said.
You have this incredibly elaborate system in order to essentially deny coverage. Oh, your thing isn't covered. Oh, this is, that isn't. No, oh, but that's, okay, this is experimental, so we're not going to cover it. All those people who are doing that kind of stuff. Then you have a big chunk of profit. You have exorbitant CEO salaries and bonuses. You've got all of that kind of stuff and more wrapped into that roughly 1/3 of all, we're paying 18.6%. Roughly 1/3 of that, it's 6% of the GNP is going into this insanity.
Right. Yeah, we're paying out for our own health care when we're paying out for our taxes for people that aren't covered, and we're paying for it in the worst possible way. Really, the only workable solution is to bond together as a group and pay for it all at the same time so we get the maximum effect.
And
it's the only thing that makes sense.
I mean, this legislation that passed during the Bush administration that says that the Social Security system cannot negotiate lower prices. I mean, excuse me? In other words, you can't deal in the marketplace. What you have to do is to take the price set by the producer. I mean, excuse me, is that not a law specifically designed to maximize the rate of profitability for an industry?
Right.
Okay. And why did we pass it? Terrorism. It's the solution to terrorism. My God, it's beyond insane. It's so laughable, except for the fact that it's killing. That this year 100,000 people will die in the United States because of denial of service. 450,000 people will die because of cigarettes. 330,000 people will die because of poor overall health. Fat, overweight, cholesterol, all that good stuff.
And everybody dies, but you want to have a good death. You want to have a life-fulfilling existence that ends beautifully.
It shouldn't be premature and painful and expensive. Okay, I mean, going out at the end, with friends and family, and when you get old, okay, I'm down with that. But premature, painful, and expensive is not my idea of the kind of system that we should be living in. So,
emphysema is a nasty way to go. Watching somebody actually battle for their last ragged breath is horrifying. It's horrifying, and I think that's one of the reasons why you see so many people in healthcare now standing up. And the largest nurses organization is all about the Robin Hood tax. They're very excited about that because they're so tired of seeing people die poorly. And they're not just adults, it's children. And it just breaks your heart, and you just know how preventable it is. All we have to do is have a little bit of money to help these people out, and then we'll be doing so much better. We'll be making money as a nation. We'll be back on our feet as a nation. The Robin Hood tax is a tax on the federal trades in Wall Street, and it would be between 0.5% or 0.005%. Really, it's about for every $1,000 that's traded on Wall Street, which is one of the least taxed industries in the United States.
I'm gonna have to cut you off.
Okay.
In other words, we came in here and you said you weren't going to be able to fill an hour, and the hour is gone. And thank you very much, and hopefully we'll get you back on here.
Okay.
But see you in the next episode, folks.
Thanks for having me.
There's something happening here, but what it is ain't exactly clear. There's a man with a gun over there, telling me I got to beware. I think it's time we stop, children. What's that?